Good morning, Matthew. My name is Jose. I work on behalf of the Washington Department of Health as part of the contact tracing team. Our job is to get in touch with people who have come into close contact with individuals who have tested positive for COVID-19. Is this a good time to talk? I only need a few minutes of your time and would really appreciate your help.
Contact tracers like Jose are an essential aspect of a multi-pronged approach to fighting the COVID-19 pandemic. Contact tracing assists in the public health response to infectious disease outbreaks when treatments are either limited or non-existent. So, what exactly is contact tracing? Contact tracing is the systematic identification and monitoring of all persons who might have been exposed to an individual diagnosed with COVID-19. Put simply, tracers are pandemic detectives who conduct patient interviews and extract important information such as the places and people the infected patients encountered when they were contagious. According to a senior scholar with the Johns Hopkins Center for Health Security, contact tracing is used to break chains of transmission, to manage epidemics at an ongoing low level, to prevent future waves or surges of cases, and to enable individuals to get back to work and resume normal routines in a much safer way.
Welcome to Module 1, Introduction to Contact Tracing. Throughout this module, you'll be exposed to the history and goals of contact tracing. You'll also learn about the importance of a contact tracer's role when fighting infectious diseases like COVID-19. At the end of this module, you'll answer 3 knowledge check questions and be able to describe the origins of contact tracing and identify the goals of contact tracing. If you need to exit in the middle of the module, you can come back and resume where you left off. However, you won't receive credit until you finish the entire module and click the Submit button on the last slide. Are you ready? Great. Let's get started. Contact tracing became a formalized public health intervention in the 1950s. It's credited with stopping syphilis, gonorrhea, and other sexually transmitted disease outbreaks. Contact tracing was also successfully utilized in both Liberia and Sierra Leone when Ebola emerged, as well as in China for SARS. Contact tracers in the United States were mostly assigned to HIV and tuberculosis cases. But the onset and magnitude of COVID-19 has increased the demand for contact tracer positions. In fact, the National Association of County and City Health Officials recommended that jurisdictions deploy 30 contact tracers per 100,000 people, or at least 100,000 people for the entire U.S. population.
The overall objective of contact tracing is to bend the curve of infection. Bending the curve means reducing the immediate spread of new infections over a specified period of time. This avoids overwhelming healthcare organizations as qualified medical professionals and scientists develop an effective treatment. The first 48 hours after an infected person displays symptoms are critical to controlling the spread. Contact tracing resembles detective work in that tracers collect information to help track the person-to-person transmission of an infection. Therefore, prompt and comprehensive contact tracing is an important public health intervention used to break the chain of transmission and contain the spread of infections. Tracers like Jose are equipped with a list of names and phone numbers or email addresses of people who have potentially been exposed to an infection. Tracers conduct interviews to extract information about transmission chains. They begin the interview by asking for locations and names of individuals the patient encountered in the 48 hours before any symptoms appeared. Questions get extremely granular to ensure the highest level of memory recall. For example, a tracer may ask,
Who came to your house in the last 48 hours? And what are their names? Could you also provide me their information? Have you gone to the grocery store lately? If so, when and where? What did you eat for lunch? Oh, you went out for lunch. Where did you go? Did anyone join you?
The information provided in the interview is voluntary and the tracer will protect confidentiality. Once the tracer retrieves enough information from the interview, they begin their next journey by reaching out to potential infected contacts. According to Sten Verman, the dean of Yale School of Public Health, the real advantage of contact tracing is to snuff out emerging or re-emerging transmission cycles.
When the health department receives a positive COVID-19 lab result, the contact tracer's real work begins. The goals of contact tracing are to: Number 1. Rapidly identify all potential contacts. The Centers for Disease Control and Prevention define a close contact as someone who was within 6 feet of an infected person for at least 15 minutes, starting from 48 hours before symptoms developed in the case, and until the time the patient is isolated. Goal 2. Monitor asymptomatic contacts and encourage them to stay home and maintain social distance from other people for 14 days to stop the cycle of infection. When a contact is unaware that they've been exposed to a positive COVID-19 patient, they go about their normal routines and essentially infect all the people they encounter. Quarantining helps break this chain of transmission. Goal 3. Ensure appropriate medical evaluation and care if the contact becomes symptomatic. If a contact shows signs of COVID-19, such as fever, cough, or difficulty breathing, they must contact their doctor and get the proper care. And finally, Goal 4. Verify that immediate isolation precautions are implemented if the contact becomes symptomatic. The CDC recommends isolation for at least 10 days after symptoms appear, and at least 3 days after recovery. If the patient does not have the ability to isolate, contact tracers provide approved recommendations and resources for a safe and healthy quarantine. San Diego County, for example, has a budget to provide patients with hotel rooms to ensure isolation. Let's take a look at an initial contact call with a patient that has recently tested positive for COVID-19.
Hello, may I please speak with Marjorie Smith?
This is Marjorie. Can I help you?
Hi, Marjorie. My name is Jamie, and I'm calling from the Porter County Health Department. Before I continue, I need to confirm that I'm speaking with the correct Marjorie Smith. So could you please tell me your date of birth?
Yes, it's May 5, 1953.
Thank you for that, Marjorie. And I see that your address is Highland Drive. If you could confirm your correct address, that would be great.
Sure. I live at 3219 Highland Drive, Topeka, Kansas. Can I ask what this is about?
Absolutely. And thank you for confirming your information so I know that I'm speaking to the right person. Based on my records, Marjorie, you recently took a test for COVID-19. Is that correct?
Yeah, my doctor called yesterday and told me I was positive for the virus. I figured I was, so I'm not totally surprised.
Well, that's the reason I'm calling. First, we want to see how you're doing and make sure that you have all of the things you need while you quarantine and recover. Second, we also want to go over a few actions you can take to better protect your friends, family, and everyone else around you. Before I get into that, though, I want you to know that everything you tell me is confidential. We don't share your private information with other agencies. And in total, it will probably take us around 10 to 15 minutes to go over all of this information. So, do you have a few moments to speak with me right now?
Yeah, I have the time. I was just lying down anyway.
I'm glad to hear that you're taking care of yourself and trying to recover. So I won't take any more of your time than needed. Also, I just want to confirm that you're able to speak freely, that you have the privacy you need to speak with me.
Yeah, I'm here alone.
Okay, thank you for that, Marjorie. You mentioned that you were lying down when I called. Could you tell me a little bit more about how you're feeling?
Sure. My muscles have been achy and I feel tired all the time, even though I don't do anything. I had quite a headache the first couple of days, but that seemed to go away. My fever has been gone the last day also.
I'm sorry to hear that you felt tired and achy, but I'm glad to hear
Debate exists about the effectiveness of using a traditional conversational approach to contact tracing versus using contact tracing technology. Some believe that personal interaction of a conversational approach cannot be substituted. For example, Steve Waters, founder of Contrace Public Health Corp., explains that the human element of contacting someone on the phone, gaining their trust, having them view you as an ally, and accepting your recommendation to self-quarantine and share who they've had contact with is very important and somewhat of an art, and may not be able to be replicated with technology. The main feature of contact tracing technology is mobile apps. Mobile apps track population movements and alert individuals when they have contact with an infected person. Research from Oxford University found that 60% of a population would have to opt in and download the contact tracing app for the measure to be successful. Professor Christoph Fraser from Oxford's Nuffield Department of Medicine says, "Our models show we can stop the epidemic if approximately 60% of the population use the app, and even with lower numbers of app users, we still estimate a reduction in the number of coronavirus cases and deaths. However, the 60% adoption rate could be challenging, given homeless or migrant populations lacking the ability to isolate, undocumented immigrants' distrust of the app's intentions, elderly populations who do not have smartphones, and overwhelming skepticism of releasing one's health data to tech companies." Given the time-consuming contact tracing interview process, alongside the obstacles associated with adopting contact tracing technology, we may not see one approach dominate over the other just yet. They will likely work in tandem to ensure that economies can stay open while at the same time containing transmission as treatments develop. As mentioned in the previous slide, contact tracing is an art that requires specific skills necessary for gaining patients' or contact's trust. If the patient or contact trusts the tracer, they will more likely abide by the recommendations. Contact tracers who are successful in their role are viewed as being part social worker, part disease detective, and part therapist. So what characteristics and skills do effective contact tracers have? Well, most positions do not require backgrounds in healthcare, but do require a high school diploma and strong interpersonal skills, such as active listening, empathy, and kindness. You'll dive deep into this topic in a future module, so stay tuned. Excellent work on the knowledge check questions. To recap, this module discussed the history and goals of contact tracing. It also examined the importance of contact tracing when fighting infectious diseases like COVID-19. The next module takes a closer look into public health, which is the science of protecting and improving the health of people and their communities.